Hi there, I hope you're doing well. This is a presentation I've put together on sickle cell disease for a self-directed study. I hope you enjoy it and learn something from it today. Here's a quick order presentation in case you're wanting to jump around a bit to look at different sections quickly. Let's start by talking about the characteristics of the disease. Sickled red blood cells are different from regular red blood cells in several ways. The most well-known difference is their shape. They have hooked edges and look a bit like a chili pepper or a sickle, which is where the name sickle cell disease comes from. It is because of this different shape that a lot of the symptoms of sickle cell disease arise, as the shape hinders them in the job they perform. Not every cell in the blood of someone with sickle cell disease is sickled. Depending on what variation of the disease they have, a person will still have over half their blood volume consisting of regular red blood cells, which function normally. Yet the average is for about 46 to 20% to be sickled, which leaves 54% to 80% of the red blood cells as normal in the average case. Because of this, some people with sickle cell disease may experience the symptoms of their condition much worse than another with less cell sickling would. Yet healthy cells don't always remain that way. Under certain conditions, such as hypoxia, during intense exercise, or at high altitudes, these healthy cells have demonstrated the ability to become sickled as well, which has a negative effect on the person's anemia. This is why intense exercise is avoided by people with sickle cell disease, as an exercise-induced state of hypoxia can cause further cell sickling and lower oxygen transport potential. When looked at under a microscope and compared with normal erythrocytes, sickled cells also demonstrated different biomechanics than normal red blood cells. Sickle cells were found to be more vicious, as well as to be on average 3 times stiffer than the regular shaped counterparts. This does not have a positive effect on them, however, as due to their irregular shape, they still tend to clot much more often, causing some of the symptoms associated with the disease. Mashiach's study in 2011 on the biomechanics of sickle cell disease is important because it tells us a bit more about the sickled cells than their chili-like shape. She reported how the shape was irregular, and both the diameter and height was both smaller in the sickle cells. She also reported that the sickled cells had a Young's modulus score 3 times higher than normal red blood cells, and were more vicious as well. Yet despite their smaller size, higher stiffness, and viscosity, sickled cells tended to clot more often than normal red blood cells, and also undergo hemolysis more often. Clotting is one of the main concerns for people with sickle cell disease. From clotting stems one of the most serious complications that can occur. Despite the small shape, size, and being more vicious, clotting occurs due to the irregular shape of the red blood cells. The sharp edges and sickle shape causes the cells to clump together and clot more often in arteries, causing partial or complete vaso-occlusion, which can require medical attention to fix. The cells also break down more often than normal red blood cells. One of the reasons for this is because they clot more often. Compared to normal red blood cells, which last about 120 days, sickled cells tend to last between 10 to 20 before breaking apart. The cells undergo hemolysis, which releases the hemoglobin, which is broken down into bilirubin in the liver. Bilirubin is part of bile and is stored in the gallbladder. Due to the high iron content, people with sickle cell disease can get gallstones more often due to higher levels of bilirubin and iron in the gallbladder. Excess iron due to hemolysis or blood transfusions can also cause damage to the liver and the heart in some cases. The sickled shape also impedes the ability of the cells to bind to oxygen. This affects the ability of the blood to saturate with oxygen and transport it to tissue which needs it. In combination with higher rates of hemolysis, which causes less red blood cells to be active in the blood, this causes anemia. Anemia is associated with fatigue, delayed growth, and puberty, lower energy levels, and feeling faint. This can negatively affect children dramatically as it impacts their ability to play sports and engage in play with their peers. This has physical as well as social, emotional, and mental consequences and can be frustrating for kids who don't understand the condition. Pain is a complication associated with sickle cell disease and comes from blood clots and decreased oxygen delivery. Pain may be acute or chronic, with chronic pain being more common for children with sickle cell disease. Triggers for clotting and pain are high altitudes, illness, dehydration, or hypoxia due to high cardiac output. Swelling hands or feet occur to sickled cells blocking blood flow. As these regions are furthest from the heart pump, they tend to swell and be affected by clots more often. This is often an earlier sign for sickle cell disease in people who are not aware of their condition. Infection occurs more often in people with sickle cell disease, especially children, due to the damage that decreased oxygen flow can cause to the spleen. Infections can cause further sickle cell specific complications, so it is common for children to be given penicillin and later chemotherapy called hydroxyurea. This is done to protect them from potentially life-threatening sicknesses, such as pneumonia, which often causes a dangerous condition called acute chest syndrome in children with sickle cell disease. Delayed growth is common in children with sickle cell disease due to anemia. Their blood does not receive adequate oxygen in some cases, and this affects the rate at which they mature sexually. Delayed puberty is common in children with sickle cell disease, although they still reach full maturity. This can affect children negatively in a social or emotional way as well. They may feel left out and may not be as involved with their peers due to the delay. It could hinder their ability to play some sports as well, where maturation and physical growth is important, such as basketball. Vision interference is another complication associated with sickle cell clotting. The blood cells supplying blood and oxygen to the eyes can clot, which leaves them without adequate oxygen. Damage most often occurs to the retina, and when this happens, it can negatively affect vision of the person. Organ damage can also occur due to anemia, as well as blood clots and hemolysis. One example is the kidneys. Sickled cells can prevent the kidneys from making urine as concentrated as it could be. This can cause increased need for urination, especially during the night. This also causes increased bedwetting in children with sickle cell disease. Further organ damage to the heart, liver, or gallstones can also be caused due to higher iron levels. As mentioned before, high iron can cause stomach discomfort and loose black stool. The effect of sickle cell disease on the pancreas has already been covered above. But another downside of having sickle cell disease is priapism, which can occur in males with sickle cell disease. It occurs due to the cells clotting and preventing blood from evacuating erectile tissue. This can cause long-lasting, uncomfortable, and not to mention unwanted erections. If the clots do not clear up within a few hours, medical attention is often sought out to stop them. While many symptoms associated with sickle cell disease are not experienced by everyone, there are several complications which pose an increased risk on the life of someone with sickle cell disease. The first more serious sickle cell disease complication is a stroke. Strokes occur when the brain is unable to receive the oxygen it needs. This makes strokes a complication with sickle cell disease, as blood clots and anemia can prevent adequate oxygen from reaching brain cells, which ends up in their death. Strokes can come in two forms, clinical and silent. A clinical stroke is a normal stroke which displays your typical signs and symptoms. Silent strokes are another kind which do not display the symptoms you'd expect, although damage has still occurred. Children with sickle cell disease are at a higher risk for experiencing a silent stroke, and due to their nature, often are unaware of what has happened. They can be detected through an MRI, but due to their unknown occurrence, most children won't receive an MRI if they haven't had any noticeable signs of a silent stroke occurring. Approximately 20% of children with sickle cell disease have a silent stroke in their lifetime. Silent strokes can cause brain cell death, which can make learning difficult for children, and it can also impact their decision making and slow it, which can be frustrating. Acute chest syndrome is a serious complication and is also the leading cause of sickle cell related death. Acute chest syndrome occurs in children with sickle cell disease of all ages. It is much more common in children below the age of 10. Approximately 50% of children with sickle cell anemia have an acute chest syndrome crisis, which requires hospitalization before the age of 10. Early signs of it are fever, chest pain, or weakness. It is often triggered by pulmonary infections such as pneumonia, which is why children are often given antibiotics at a young age, given their increased risk for infection. Acute chest syndrome occurs in hypoxic environments and is a terrible cycle of infarction, inflammation, and then incomplete filling of the lungs. It causes hypoxia and high blood pressure in the pulmonary circulatory system, and an acute chest syndrome is dangerous because it can progress from hypoxia into respiratory failure all within 24 hours of the first symptom. This makes bringing children into the hospital important because after any symptoms occur. Acute chest syndrome can be mistaken for asthma, pneumonia, or bronchitis at its early stages, but is usually detected through an X-ray image. Sudden exercise collapse or sudden death syndrome, or exercise collapse associated with sickle cell disease, are names for a sudden fatality during intense physical activity. While the exact mechanisms are not known entirely, it occurs more often in individuals with sickle cell disease and sickle cell anemia. Exercising in conditions that heighten one's risk for hypoxia, such as high altitudes or in hot weather, can increase the risk for this occurring. It has been noticed during military training and athletics, which has stemmed further research into the phenomenon. Sickle cell disease is often categorized into two different categories, although there are different classifications as well. The more common and less dangerous one is called sickle cell trait. It occurs when a child receives one mutated allele for hemoglobin from a parent, causing red blood cell sickling. The percentage of sickled cells in someone with sickle cell trait is often much lower than in someone with sickle cell anemia. This causes the person to experience much less sickle cell-related symptoms, and anemia is sometimes not even present or noticed by the individual. Just like sickle cell anemia, though, sickle cell trait is much more prevalent in populations which come from regions where malaria is endemic. Sickle cell anemia is often more serious, as individuals experience higher rates of clotting and worse anemia due to having more sickled red blood cells. This can lead to experiencing more sickle cell-related complications as well. Sickle cell anemia is called a homozygous mutation and occurs when a child inherits the mutated allele for sickled hemoglobin from both parents. This makes it much more rare, yet it still occurs much more often in populations of African, Hispanic, Southern European, Asian Indian, and Middle Eastern descent. Since sickle cell disease is only inherited from a parent who has the genes for it, its occurrence in babies born is much higher in populations which already have high rates of the disease. Yet sickle cell disease isn't just known for the negative aspects it has. It has been proven to increase people's tolerance to malaria and the infection that causes malaria. This means that having sickle cell disease is not necessarily negative in regions where malaria is endemic. This is also the reason why sickle cell trait, which has few symptoms, is sometimes not considered a disease, as it increases people's tolerance to malaria while not impacting them with the anemic symptoms as badly as sickle cell anemia. Due to natural selection, people from regions with malaria tend to pass on the genes to their children, whether still in the region with malaria or not. This is why the African American population has a much higher prevalence of sickle cell disease, since they come from Africa, which has higher amounts of malaria. On the contrary, people who do not experience malaria in their region would only experience the negative aspects of sickle cell disease, causing the genes to be reduced over time in the population due to natural selection, which is why people native to North America have much lower amounts of sickle cell disease in their populations. While complications associated with sickle cell disease, such as acute chest syndrome, have many different diagnoses that occur, sickle cell disease is often diagnosed correctly because it can be detected through having your blood tested. Despite this, it can be mistaken for the genetic conditions hemoglobin C or hemoglobin SC if an alternative test method is used, such as electrophoresis. Hemoglobin C is different because it typically just means that the blood cells undergo hemolysis prematurely. This can cause anemia, however clotting is not as common as it is with sickle cell disease. Hemoglobin SC is a combination of cell sickling as well as having hemoglobin C being produced. Normally about half of a person's blood volume is sickled, while the rest of the blood cells are of the hemoglobin C variety which undergo hemolysis early. Blood tests are very common though, and very exact, so normally a differential diagnosis does not occur. Besides being at risk for many complications associated with their disease, children are further impacted by having sickle cell disease beyond just the listed symptoms. Physically, children with sickle cell disease, specifically anemia, may not have the ability to transport oxygen as well as their peers without training. This can be frustrating for children who love sports, as aerobic fitness is often a crucial aspect of sports performance and success. Their disease can also affect their ability to join in on play or other recreational activities. If they are not capable of maintaining their cardiac output at a level that is comfortable for them, recreational activities such as swimming with the school or going skiing may be dangerous for them, and their parents may also discourage them from participating as they worry about their safety. Delayed physical growth, as well as delayed puberty, can also impact children involved in sports. Hitting puberty early can be a physiological advantage for young athletes, and delaying that growth could negatively affect a youth's performance in a sport or activity they love to compete in. Symptom management can have a great deal of stress on someone with sickle cell disease. Having the disease does not mean you can't partake in physical activity or do well. It just puts you at a higher risk for complications occurring. Managing your cardiac output and being constantly aware of your symptoms or the possibility of something occurring can be mentally draining and difficult for children. Having a genetic disease can also lead to negative self-talk within children. Someone with sickle cell disease who's been told that it affects their ability to transport oxygen may fall into the trap of deciding that aerobic training isn't worth their time given their genetic condition. They also may fall into the trap of labeling themselves with something that isn't true, such as that they might think they're a bad athlete due to their condition. Psychology and labeling theory suggests that people tend to grow into whatever labels are placed upon them, and negative labels such as that could cause further harm to kids with sickle cell disease mentally. It could also cause the child to think of themselves as not normal or healthy, when they are in fact healthy. Just because someone has sickle cell disease does not mean that they have to live a restricted life. People that can still live very active lives and may not even be impacted by their condition, such as if they have mild sickle cell trait. Sexual maturity being delayed can be difficult for a child emotionally. It's already difficult for a child when they begin producing more hormones and feeling differently. But watching friends go through this before you and not experiencing it yourself can make a kid feel different from their peers. Pain due to clotting can be a constant part of a person with sickle cell disease's life. Chronic pain is more common in children than it is in adults. And besides the discomfort caused by pain, it can also serve as a reminder for the child that they have a condition making them feel unwell. Kids with sickle cell disease also experience hospitalization more often than their healthy peers. This can be difficult to navigate emotionally because often kids do not understand the magnitude of things when they are brought to the hospital. Half of children with sickle cell anemia are hospitalized with acute chest syndrome before the age of 10. And this period can be emotionally confusing for the child and extremely difficult for the parent as well. Missed school due to hospitalization and sickness can also be tricky for kids because it means they miss out on school and time with friends. This can cause them to miss out on fun school trips, and it may cause children to resent themselves for having sickle cell disease, even though they were born with it and it is out of their control. Delayed physical and sexual maturity can also have an effect on them socially. Although maturity is still reached, it could limit their interactions with partners at a younger age. It also could affect their interactions with their friends who have gone through puberty already. Having sickle cell disease can also deter the child or the parent from having them participate in sports. They could worry that it may make symptoms worse, and kids could miss out on important socialization that occurs from being part of a team. I'm going to talk about several of the most common treatments for sickle cell disease. Since it is a genetic disease, it is hypothesized that gene splicing may end up helping people with sickle cell disease, although currently it is not an option for treatment. The only cure for sickle cell disease that has been done is stem cell therapy. Children or adults with extreme symptoms of anemia are often given the treatment, and it is only performed sometimes because it is quite dangerous, invasive, and exposes the individual to many complications. The therapy involves undergoing chemotherapy to remove the marrow-producing sickle cells and kill off the red blood cells that are sickled as well. Next, healthy donor stem cells are introduced into the marrow, usually from a spouse or a sibling, with the aim of having these new cells produce normal red blood cells to replenish the blood volume. Complications occur if the cells are not accepted by the individual, and this is why the therapy is not always undertook. Blood transfusion is an alternative measure that allows for longer-term management of anemia than medication does. Healthy donor blood has the red blood cells separated from it before it is introduced intravenously into the individual with sickle cell disease. While this relieves symptoms of anemia, it increases one's risk for infection and also introduces a lot more iron into the body. Iron chelation therapy is often done if someone frequently has blood transfusions. This is done to remove excess iron because if it isn't removed, there could be additional organ damage, such as we talked about before. Oral medication is a popular option of treatment for individuals with sickle cell disease. Infants with the disease are often given penicillin from birth until about 9 months in order to help prevent infection, as their bodies are also more susceptible to infection since they have sickle cell disease. Infants are normally transitioned to hydroxyurea after they stop taking penicillin. Hydroxyurea is an oral chemotherapy safe for long-term daily use. It is used to treat sickle cell anemia because it helps prevent sickle cell formation as well as clots too. Physical activity is still a great way to raise aerobic fitness levels, and as well, it also lowers one's risk for chronic conditions. While intense physical activity is a risk factor for people with sickle cell disease, responsible exercise can actually benefit individuals by increasing their capacity for aerobic activity before the onset of symptoms like dehydration or hypoxia. Participating in aerobic exercise training for 6 weeks is shown to both increase aerobic fitness levels of children with sickle cell disease by 10%, as well as reduce the mean amount of time spent in hospitals. None of the children that participated in the study experienced any exercise-related symptoms over the 12-week period as well. While intense exercise should be avoided, individuals who have cleared it with their doctor should exercise responsibly in order to manage their symptoms and lower their risk for other chronic conditions. Exercise is also especially important for children with sickle cell disease, as it promotes healthy musculoskeletal development as well as enhances motor learning. Exercise should always be done in a controlled environment where you can start and stop at will. This will allow the individual to choose a pace that suits them. Starting slowly is recommended so that the individual with sickle cell disease can become more aware of the level of exertion that they feel safe with and comfortable. When going without training for a while due to vacation or perhaps illness, it is important that individuals return slowly and acclimate themselves to activity, as returning to the level they were at before could put them at a further risk. Hydration is also an integral part of responsible training. Exercise causes the body to sweat and lose water, which increases the thickness of blood if proper hydration is not maintained. This can increase the risk for blood clots in people with sickle cell disease, according to experts. Because of this, people should exercise when they have access to water and stop if they are feeling dehydrated. While moderate exercise can be very beneficial for increasing an individual's capacity to be active without symptoms, taking things too far can still happen, and it is important that after any sign of this happens, exercise is halted. Signs of exercising too intensely are fever, dehydration, feeling faint, or overheating. It is also important not to exercise too hard if you have sickle cell disease, because people with sickle cell disease experience greater rates of exertional rhabdomyolysis, which is the breakdown of striated muscle tissue. Exercising responsibly and moderately is key to increasing one's fitness levels and avoiding health complications. Thank you for your time. Hopefully you've learned something today from my presentation on sickle cell disease. Here are the works I consulted in making this presentation. I encourage you to look through them if you're interested in learning more about the disease. Take care. Bye.